The Minister of Health is warning private healthcare providers against fueling the spread of coronavirus by withholding results to families who lose their kin to COVID-19 disease. Health Cabinet Secretary Mutahi Kagwe, who was in Kisumu County, said that there was need for factual information to help in the disposal of such bodies based on public health protocols and save the grieving families from the danger of contracting the virus instead of thinking of decent burials and stigmatization. The government is raising a red flag over unscrupulous doctors who are colluding with families of those who have died as a result of COVID-19 to falsify test results in a bid to facilitate decent burials. The Minister of Health pointing a finger at private hospitals trying to make a kill in the guise of fighting stigmatization, that they are only helping to fuel the spread of the virus and that the government will clamp hard. Health Cabinet Secretary Mutahi Kagwe warning that at the last stage of human life, the virus is so potent and as such poses a major threat if not handled well during the disposal of the bodies.
There are a few doctors who are behaving very strangely, and this has been brought to our attention by the doctors themselves, especially those apparently in the private sector, who are undermining the process of protecting families by exploiting their emotions and colluding with some of them to ensure that burial rites are observed normally. Some go to the extent of denying valid positive results to family members of people who die from COVID-19 complications with deadly consequences.
Kagwe spoke in Kisumu as the country recorded 599 new coronavirus cases in the last 24 hours with 2 deaths. Kenya now has a cumulative caseload of 26,436. During the same period, the country recorded the highest number of discharges with 1,062 recovering from the virus, and recoveries now stand at 12,961.
373 are male and 226 are female. I think women are beginning to come closer and closer. That's not a good thing.
The CS challenging Kenyans, mainly young people, that the world is facing an extraordinary time and each individual is responsible to stay alive by keeping safe.
It's really disheartening when, as a young person, I don't know how you live with yourself when you know that you have killed both your parents and perhaps some relatives. What does life look like after that?
Nairobi County continues to lead with 318 cases, followed by Kiambu County, which recorded 70 cases, Nakuru 39, Machakos 38, Mombasa 28, Kajiado recorded 26 cases, Kericho 14 cases, Isiolo 10, Kisii 9, Kakamega 6 and Kisumu 4 cases. Purity Museo, Channel 1 News.